Mr. Speaker, Canada's vaccination rate is the lowest in the G7. The Globe and Mail pointed out this morning that Canada will need to vaccinate 300,000 people per day, or 2.1 million people per week, to meet the September deadline the Prime Minister keeps promising. So far, only 124,000 Canadians have been completely vaccinated. Where is the Prime Minister's plan to vaccinate 2.1 million Canadians per day?
Right Honourable Prime Minister.
Mr. Speaker, we have had a strong plan on procuring vaccines since last spring. We signed more deals with more potential vaccine manufacturers for more doses per capita than any other country, and that is paying off. We're getting shipments of vaccines into Canada. We're delivering them across the provinces and territories who are getting them into arms, and we continue to be on track to receiving the 6 million doses promised by the end of March, 20 million doses in the spring, and we will have all Canadians vaccinated by September if they want one.
Mr. Speaker, delays in the vaccine mean more people will fall sick and more people will lose their lives. But on top of that, the mixed messages and confusing messages from this government around the ability to produce the vaccine in Canada will erode public trust. The Prime Minister said we would be able to have that production capacity by September. His minister said by the end of the year, and the NRC says by 2022. We have long called for, New Democrats have long called for local production of the vaccine. Why didn't the Prime Minister start a year ago to plan to have this capacity here in Canada so we can make the vaccine here in our country?
The Right Honourable Prime Minister.
Mr. Speaker, we did start working on creating biomanufacturing capacity a year ago, which is why we immediately made investments in Medicago, Vito Intervac, the NRC, and Abcelera as we developed domestic vaccine capacity. But at the same time, we signed contracts with companies around the world to ensure that we would be able to get Canadians vaccinated. And despite the fears being peddled by members of the opposition parties, I can reassure Canadians we are very much on track to get the 6 million doses or more planned for the end of Q1 and to have everyone who wants a vaccine vaccinated by September. That's the plan we're working with, and that's what we're delivering.
Mr. Speaker, earlier in question period, the Prime Minister said that there would be fluctuations, that's his word, in vaccine delivery in coming weeks. And that's a big problem because if there are unexpected, quote, fluctuations, it makes it very difficult for the provinces to properly time the 2 doses of the top candidates. So fluctuations are a problem. Can the Prime Minister tell Canadians if he's expecting a reduced or zero shipment from Moderna on the week of February 22nd?
Right Honourable Prime Minister.
Mr. Speaker, we knew that vaccine production was going to be a massive challenge for companies around the world to develop and produce a vaccine that didn't exist yet when we were signing these contracts last summer. That's why we signed so many different contracts for so many potential doses for Canadians to ensure that we would be able to get Canadians vaccinated regardless of challenges or, yes, fluctuations in the week-to-week delivery program. That's why we can continue to guarantee we will receive those 6 million doses we promised by the end of Q1. We will have everyone vaccinated by September of 2020 who wants one.
Yeah, the Honourable Member for Calgary, Nose Hill.
Well, if the Prime Minister is admitting that he knew there would be problems with delivery because he depended entirely on signing contracts with other countries for production, maybe he should have had a plan to develop domestic capacity before the end of this year. I think it's really important for the Prime Minister to be clear on this on behalf of the provinces and every public health person who's trying to deliver vaccines. Is he expecting limited or no doses from Moderna to be delivered on the week of February 22nd?
The Right Honourable Prime Minister.
We are continuing to expect shipments from Moderna this week and in the weeks to come. We will continue to advise the provinces as soon as we get concrete numbers on different deliveries. But yes, they will continue to deliver hundreds of thousands of vaccines across the country. We are on track to receive all the vaccines that we were promised by the end of March. That is 6 million doses from Pfizer and Moderna. And we are very much on track to getting 20 million doses in the spring and everyone who wants it vaccinated by September.
Well, Mr. Speaker, the Prime Minister said he knows that Canadians are looking forward to traveling again, but at this rate, there won't even be an airline sector. Yesterday, Mr. Speaker, the Minister of Transport stated that airlines voluntarily gave up their routes to sun destinations when they've been suffering for months without any assistance from this government. Airline workers and unions, they've been good partners. They repatriate Canadians. They continue to deliver medicine, food, and supplies all across this country. Why doesn't the Prime Minister just admit that he continues to make airline sectors pay for his government's incompetence rather than helping them?
The Right Honourable Prime Minister.
$1.5 billion, Mr. Speaker. That's how much we've sent to the airline sector since the beginning of this pandemic to support workers who are affected by this pandemic. We know that the airline industry has been hit hard. We've been working closely with them for months. We will continue to make sure we're doing everything necessary to keep Canadians safe and to ensure that we have a competitive and prosperous and successful airline industry here in Canada once this pandemic is through. The work with the airline industry continues, is ongoing. We need to make sure that we get through this all together.
Mr. Speaker, you know what would help the tourism sector, small businesses, family-owned enterprises in crisis? A national rollout of rapid testing and vaccination, two things that this Prime Minister's leadership is making Canada 6 months behind other countries on. It's leadership that's required, Mr. Speaker, not his talking points that we've heard today. So his general today couldn't say how many Moderna doses were coming on February 22nd. The provinces need numbers for their plans, Mr. Speaker. So my question is simple. Prime Minister, how many Moderna doses will be delivered on February 22nd?
Right Honourable Prime Minister.
Mr. Speaker, I've been very clear on our continuing confidence in receiving all 6 million Pfizer and Moderna doses by the end of March, and by our ability to vaccinate everyone by the end of September. But at the same time, let me pick up on something the Leader of the Opposition said. He talked about rapid testing and when are we going to roll out rapid testing. As of last October, we rolled out millions of rapid tests to provinces across the country, and I can say that there are a number of provinces who've put those rapid tests to good use. Indeed, testing in businesses, testing in long-term care homes, but there are still millions of those rapid tests not being used by the provinces and territories, and perhaps the Leader of the Opposition could encourage some of his Conservative friends